deliver to your practices, and how participating supports the greater network as well. So kicking us off, Jana is going to be talking about Vatica, which I know many of you have heard about before, but this is going to be a major focus for provider relations in 2022, is connecting providers with Vatica so they can see the value of this program. And we're going to talk about Atlantic Health Partners, Medline Provista, PCMH Consulting, our Fidelis fee-for-service rates, and then the Pediatric Vaccination Toolkit, which is a brand new item. So I'll turn it over to Jana to talk about Vatica.
All right, thanks, Renee. First, I am going to apologize. This is going to be the most talking I've done in a week or so, and my daughter brought COVID from daycare, so if I sound winded, that is why. So the first thing we have here is Vatica, and Vatica it's a risk adjustment program that provides incentives to the providers who are participating in that program. And really the purpose is to make sure that we're accurately coding, or the providers are accurately coding these HCCs for Medicare populations. And so what that means is, over time, some people who have complex conditions, sometimes the providers continue to treat those conditions, but the coding for it actually falls off. And that inhibits the ability to actually capture as much funding from Medicare contracts as possible. And so Excellus really wants this to happen, because when those codes are captured correctly, then they get more money from CMS. And AHP thinks this is really important, because when Excellus gets their, the most accurate share of money, that positions us really well for gain sharing under those Medicare contracts. So, we really are trying to revitalize this program, get people to, sign up and continue to sign those records in Vatica. There are other payers who are participating in this program, which is going to be on the next slide. But if you have any questions about the program, you can reach out to me directly. My email will also be included at the end of this presentation. And many of you have my number, so you can always reach out and we can talk more about that. So with Excellus, they are participating in Medicare Advantage commercial, and the Medicaid pilot was actually just expanded on 3/1 of this year. So they are now contributing, including Medicaid populations into that. We also have Health Now, Humana, MVP, Univera, and WellCare that participate in the Vatica program. So it's a really good opportunity. Again, that 225 is really a base that you can make. You also have some options for penetration bonuses and things like that. So it's a good program to consider, especially if you have a really good spread of this Medicare, commercial, and Medicaid Advantage for Excellus. So if you have any questions about that, please reach out and we can chat more. Atlantic Health Partners, the other AHP. I know I started writing this when I first started, and I was like, oh, that's not going to be super clear if I just write AHP twice. So this is the vaccine purchasing group that AHP is contracting with. They give favorable pricing to our our provider membership on all of the big hitters in vaccines, so Merck, Sanofi, GSK, etc. With this program, you also, in addition to the favorable pricing, you also get some quarterly and annual rebates with that. And there's better terms like if you make big purchases, you have longer to make those payments towards them. This is available to pediatric, to all of our private practices. And you can order pediatric, adolescent, and those adult vaccines in addition to travel vaccines. A good thing to note here is if you're a primary care or OBGYN private practice, this is available to you. For some of the groups that are employed practices by one of the systems, you won't be using this program. Has really good endorsements from some of those big physician affiliations. So, they are a reputable company. It's really good in terms of what you get out of the deal. So this is another thing that you can reach out if you have some questions about. And then Medline. So Medline Provista, another partnership that kind of arose throughout during the pandemic. And this offers favorable pricing. So you get the same pricing that URMC gets from Medline for their products. And on average, folks are saving about 28%. We really wanted to hammer in that you don't have to exclusively use Medline for all of your purchasing. If you've got a vendor that you use and you're happy with, you can continue to use them, but use Medline for some of the specific items that you might have a need for. One thing that I know they've been working really hard and doing well with is N95s. At some point, it was really hard for folks to get their hands on those, and Medline was able to do that, and obviously at a decreased pricing. So another thing, if you've got any questions about this, you're interested in learning more about that, please reach out. But you don't have to move every piece of purchasing over to Medline in order to take part in this. So it's a good opportunity.
Thanks, Jana. And I would note too on that last point that because of it, yes, it absolutely is non-exclusive. And if you see products for Medline that are available at Medline that have a better price, better availability, and you want them, you would need to already be contracted with Medline to start taking advantage of accessing it. So even though right now you might be really pleased with your current vendor and you don't see a need, it might be worth your while to still have us connect you with the Medline folks, get the practice signed up, have the account created. So should the time come that McKesson is experiencing a shortage that Medline is not, you're able to immediately tap into Medline and get the items that you need. So you can contract with Medline without having to have a minimum monthly purchase or anything like that, but just have that relationship ready to go when you need it. So just a best practice that I've heard from some of the practices in AHP, that this is the way they've been managing their medical supply buying. Okay, so next item we wanted to talk to you about to make you aware that belonging to AHP has a benefit for, and that is PCMH consulting. We have been working with RMS Healthcare for some time. Many years ago, we're subsidizing 100% RMS healthcare services, working with our practices to obtain patient-centered medical home recognition. AHP is no longer in a position to subsidize 100%, but what we are in a position to do is to work with RMS Healthcare and negotiate rates for our members that are very advantageous compared to their rack rate that they would charge you if you were coming in off the street without an AHP membership. So what I have up on the screen right now is what the current discount rates are for an AHP practice working with RMS Healthcare. They have a package that is specifically for patient-centered medical home if you're starting up for the first time, or you're getting into that annual reporting cadence with NCQA. You'll see all the pricing up there, and it is very advantageous. And then they also offer discounted rates for their hourly consulting, maybe that isn't related to PCMH. And this slide shows just the number of consulting services that PCM or that RMS Healthcare has available to assist you. So if you're interested in working with RMS, or if you're working with them currently and are thinking of other ways to work with them, just want to make you all aware that there are significant discounts. Feel free to reach out to us for any more information, or you can reach out directly to RMS. All the email addresses and contact names that we're talking about throughout our presentation, we have at the end, and we're going to be emailing these slides out to everyone. So don't feel that you've got to furiously scribble down email addresses. So PCMH consulting or other healthcare delivery consulting services are available from RMS, and we feel they're a reputable company who tries hard to meet your needs. Anyone on the call who's worked with RMS wants to say anything? It's awful quiet out there. I'm going to throw a question out, see if I can get someone talking. Anyone care to share their experience with RMS, good, bad, or otherwise? We want to hear it. Okay. I'll move on to, excuse me, the next item.
We have been furiously and feverishly surveying our practices. Many of you probably gotten a survey recently asking what kind of vaccination in the office are you doing, if any, who are you vaccinating based on age and things like that. And this is really coming we are expecting within the next month that the 6 month to 4-year-old age group is going to be eligible for vaccination. So we really, sorry, that's my pup. So we really want our network to be prepared and ready to handle that vaccination, as the counties and Finger Lakes have really stepped out of that. They are not going to be vaccinating this age group. And so we really need our providers to be ready to pick up that lift. And so part of what we've done here to assist with that is actually developing a toolkit that really goes beginning to end, and walks practices through how do we stand up vaccination in our clinic, what are some of the best practices, and what are the steps that we need to take to be able to do that well. So I've already had some conversations with folks regarding this. If you haven't heard from me and you're a practice that is not currently vaccinating this 5 to 11 age group, and you have a population there, we will be reaching out, so you can expect to hear from me about this. And we'll be talking more about how we can actually get folks vaccinating and what are the barriers and how we can work through that. So that is the vaccination toolkit. It is available online on our webpage, and we can send that out with the presentation as well, a link to that so you can take a look at it. But it also comes with some really great resources surrounding vaccine hesitancy and misinformation that we know are going to be really big, especially with this youngest population. So if there's any questions about that, ask them now, drop them in the chat. But that's the toolkit.
Thanks, Jana. Wow, AHP has come a long way since March 2020, when we were all sitting around the conference room going, I don't think AHP has a big role to play in this COVID thing. I really think that's the health department's patch. And here we are 2 years later, putting out toolkits on how to help you stand up pediatric vaccination for COVID.
And Renee, thank you for being nice enough not to say that those words, I think, actually came out of my mouth.
They came out of your mouth, and then I high-fived you in agreement. So
fair enough.
I think we're both culpable there. Yeah, so Jane is going to be our leader on this rollout of the pediatric vaccination toolkit, and we definitely encourage all of our practices, if at all possible, if you can, to stand up pediatric vaccination, and if not, to start talking to start building referral relationships. So if you have patients who need vaccination, that you have somewhere to send them, and we're happy to help facilitate those conversations as well. So I'm going to move on now to, we are zipping through our agenda, but no one gets mad when a meeting goes short, so I'm not going to worry about it. I'm going to turn it over to Elizabeth Sharp, our Director of Performance Optimization, to talk about our 2022 quality measures.
Thanks, Renee. And I'm happy to wax poetic about quality measures if you want me to
Please
add a little filler to the agenda here.
Yeah, build the lily, go for it.
So we have finalized our 2022 measure grid. I'm sure everyone is thrilled to hear it. We have a couple of changes from last year that I wanted to call out. So if you'll see here, we have a limited number of measures. We're really trying to keep the quality measures easy and consistent for our providers. But we do have a few changes from last year. So we have actually removed lead screening from our quality measure grid. The reason for that is not that we don't think lead screening is really important. We do, but we have had an issue. There's been an issue with the lead-2 analyzer test kit reagent with the control. So as all of our pediatric practice managers probably know, there was a recall last year. So we're no longer able to do point of care testing. We've been in touch with the manufacturer. They're waiting on FDA approval. We anticipate that this is going to be ready to go back in action later on this spring. We're very excited for that, but don't want to penalize our practices for a measure that they can't control right now. Obviously, you can still send kiddos out to the lab. We hope that folks are doing that, but we know that the uptick there is really challenging. So we have removed that from the quality measure grid. We've also added in a new measure. So if you look at the WellCare in the first 30 months of life, the WellCare 15-month measure is standard. We've had that on our grid for a long, long time, as long as I've been at AHP. The 15 to 30 months is new. And the reason that we've taken that is, frankly, now we have to. They're bundled. So we needed to put that on there. What we're doing is putting that on as a report only. So everybody's going to get the full points in year one. We're going to be tracking how folks are doing from a performance perspective. And then in 2023, we're going to be poised to take that as a pay for performance measure. Everything else on here should look familiar. It's the same core measures as we had last year. So does anybody have any questions about the grid? I will also say, just as a quick reminder, this is what I'm referring to as our family medicine grid. If you are in an internal medicine practice, you will only be responsible for the quality measures that impact adults. Similarly, if you are in a pediatric practice, you will only be responsible for the quality measures that impact pediatrics. One thing that I'm sure Renee is going to get to when she and Jana talk about the provider engagement report is you'll notice depression screening is not on this quality grid. It is still a very large part of our quality program. And it is still a very, oh, I'm seeing chats. I get distracted by the chat. So yes, this will be shared with our providers. And it's going to go live in Arcadia. I'll get to that later on this month. Depression screening, not on the quality grid, but it's going to be a part of the provider engagement report. We really wanted to structure something so that our practices could get more actionable data about the patients who needed screening and the patients who needed follow-up. So that's where that is going to kind of live in our quality program, but it's still very, very much an initiative that AHP is focused on this year. Next slide. Thank you. So we do have our measure definition page. You can find this on the AHP website. I would look at Willie because I know he's here, but he's not one of my people that I can see right now. I don't believe it's put up yet, but we will be pushing this live when Arcadia is updated.
It's up.
Oh, it's up. Okay,
It's
there you
live.
go. I've been clicking on the link he sent me via email, so I've been cheating. So if you have questions about measure definitions, you can go ahead and click on one of these, and Renee, I'll have you go ahead and go to the next slide. And it gives you this beautiful one-pager with a general description, the definition for the denominator, so how a patient qualifies for the quality measure, the numerator for how they satisfy it, any changes, any exclusions or exceptions. And you can see in the upper right-hand corner, those targets. It shows our thresholds for the percentiles. So that's those hash marks in Arcadia, how we figure out how we're performing. And you can also see the changes from 2021. So these thresholds are national benchmarks, and they do change year over year. This will give you some insight as to whether, frankly, it'll be easier to hit the measure in 2022 or harder. If we have an initiative that AHP is working on or some clinical guidance, some resources that are available, you'll see that under the initiatives header, and you can click through and it will link you. So this is adolescent immunizations. You can click for HPV vaccination information. And Renee, if you don't mind, thank you. It'll take you to that clinical guidance or the resources that we have available on the site. So there are other ways to access these clinical resources, but if you're kind of going down that quality measure rabbit hole, that's the easiest way to flip over. The 2022 quality measure is going to be live in Arcadia on March 28th. I'm probably more excited about this than anybody else on the call, but hopefully you guys are looking forward to it as well. Does anyone have any questions about quality measures, about the program? Okay, thanks, Renee.
Thanks, Elizabeth. I would also point out to Elizabeth's comments about that new measure for well care visits for 15 to 30 months. I want to remind people that our Well Child roadmap that we printed up, that we finally call Candyland, is available. So if any of your practices need additional copies of that Well Child, the preventive care roadmap, please let us know. It's been well received by our practices and by their patients. And then I do want to let folks know, to Jamie's excellent question, the way that we roll out these measures and how we make sure that we're building awareness among our providers for them. First mention was in our most recent network news, where we made folks aware that this grid had been agreed upon and included the link to the website resources for it. We presented it to our PCP advisory committee, both adult and pediatric. We're presenting it to you. We have some upcoming incentives that are coming out, and with the communications about those incentives will be included materials about the 2022 measures. So we certainly try to keep, as Mark likes to say, 7 ways, 7 times, or 7 times, 7 ways, just making sure every way possible that we are putting this information in front of providers so they understand what it is that they are on the hook for. And certainly our efforts, segueing into our next item for the PCP reward plan and provider engagement report, as we're rolling out this brand new resource to accompany a brand new incentive plan. The attention to the quality measures is baked in, right? Because that's the basis for a large portion of the reward plan. So with that, I will turn it over to Jana to walk us through the new PCP reward plan and the provider engagement report that accompanies it.
Okay, so exciting times. So the new reward plan is effective for this year, for 2022. And so with that, what you can really expect is this combination payment. So the current model is multiple quality incentive payments throughout the year, and then gain sharing funds, if we get gain sharing, as another payment. So with the new reward plan, it's going to be a combination of those two payments. So one payment that's paid out in September of the following year. And so the goal here is to just really better align how incentives are paid out with the network's accountability to cost and performance. So a big part of that is going to be the new provider engagement report that we're all super excited to introduce. And it shows you that progress towards the incentive. We obviously don't know exactly, what gain sharing will be, if there will be gain sharing, but what we can say throughout the year is this is how you're doing based on what you would attain if we get gain sharing. So it's a good tool to have. Next slide. So how that is really broken up is it's going to have 3 main components. So the quality program, cost saving initiatives, and then citizenship. So in that quality program, just like Elizabeth was mentioning, depression screening is not a measure, on the grid, but it is 10% of the quality program. And so how you're capturing depression screening and follow-up data does contribute to your incentive here. Then the other 50% in that category is the quality measure. So that measure grid, how your performance, how you're performing against those quality measures does contribute to this 60%. So the cost saving initiatives are, thank you, Renee, long-acting reversible contraception, and then pharmacy. So there are some groups that aren't going to be participating in LARC or pharmacy simply because of the nature of their practice. If that happens, that 30% is redistributed against these other categories. And, so you're not going to get zeros in that category just because you don't perform one of those services. So that's really important that, people understand that. And then citizenship. So it's going to make up another 10%. And in the citizenship category, we're really looking for how is this practice engaging with AHP in a meaningful way? So different things that we're talking about that will fall into citizenship are things like this, attending these practice manager meetings that will hit your citizenship for your practice. Serving on some of those advisory committees. We also have Vatica that's going to be an initiative towards citizenship. So this is really what the incentive is going to look like in the reward plan. And so you can see how we're really trying to better align those goals with how we're paying out incentives to the network.
I just want to call out that point again. For those of you on this call, you are halfway towards earning the citizenship incentive for every provider in your practice. So thank you for your contribution towards their success. This is an important activity for your practice, and we're so glad that you're willing to come and get this information and also satisfy that requirement for your providers. Sorry to interrupt, Jane. I just wanted to.
No, you're fine, which is a good point. If you haven't dropped your name in the chat and where you're coming from, this is a good time to do so. And that actual provider engagement report. So the PER, as we're calling it, this tool really enables providers and practice managers to gauge and manage your performance through this new reward plan. It provides snapshots throughout the year of the quality and total spend if you're in one of those initiatives like LARC or pharmacy. And then also your progress towards the incentive. So as I mentioned, you know, if the year ended now, are we at that 50th percentile? Are we at that 75th or that 90th percentile in terms of, you know, our progress towards our incentive? This is going to be an electronic tool, and it's going to be really nice because it's going to be up to date. It's going to be real-time actionable data that you can use. We're in the process of rolling this out as a pilot to some practices and getting their feedback and really, you know, tweaking this so that it's as good as we can get it for you guys. So it does have customized opportunities for improvement. And that's, you know, another part is we really want this information to be actionable. So all of the things that are included in the PER are specific to your practice and at some level specific to your provider. So it's really a really good tool that we're excited about. And the next one, so this just shows a snapshot of what this looks like. You know, we are taking out readmission because of some of the quirkiness of that data, but we're, you know, exploring how to make that better and how to get that contributed back again. But you'll see here, depression, pharmacy costs, LARC, citizenship, all of that will be shown on the dashboard. And then right at the top, we'll show your cost versus quality. So this bar looks a little different in the real tool, but it will show kind of, you know, you've captured 91% of the points that you're eligible to capture based on, you know, those other incentive categories in the reward plan. So, you know, we will be reaching out to practices as we continue the implementation so that we can start training folks on this, start getting people in to use the tool for the full rollout this year.
I just want to jump in here to respond to a chat that I received, and I think
Okay.
it's good information to share with the full group. The question was, how do I know which of these initiatives I'm involved in? And that's a really excellent question. And when we implement to your practice, when we roll it out, we will make you aware of, you know, yes, you have pharmacy opportunities. Your providers are going to be eligible for that 15% in pharmacy, or you have LARC opportunities. Your providers are going to derive 15% from LARC. And just want to point out that if there are providers for whom there are no opportunities in a cost savings initiative, then you're not going to earn zeros. You're not going to miss out on 30% of your incentive. Rather, we're going to reallocate up to the quality program and to citizenship. So never fear, we would never just disincentivize anyone in that way. But excellent question, and we will absolutely, in our efforts to roll out both the reward plan and the provider engagement report, make sure that every provider and every practice knows exactly in what domains they are active and have opportunities for earning incentive. Thanks, Jana. I think we were here.
Yes, so we are, you know, like I mentioned, we're right here in that implementation phase. And so these are the big things that will happen when we reach out to you to start implementing PER at your practice. So first, we're going to really want to identify those project champions. Who are the folks who are going to be working with us closely to stand up the implementation, get the tool running in your office, and really championing within internally to other folks. So once we figure that out, we will start scheduling some demos. We'll review that reward plan and demo the PER. You can ask questions. It's you know, I've gone through it now, and it's a really good demo. Really walks you through the tool and how to use that, what that data looks like for you. And then just to establish system access for approved users. So that might mean that your practice manager and your providers have access. It might just mean that, you know, providers have access. Kind of depends on how your practice plans to use the tool. But we'll establish who is going to do that. And then we'll work with our ISD side of things to get those accesses established. Then we'll do the training and obviously get your feedback. So we really just want to make sure that you have time to get in, use the tool appropriately. And then, you know, we're about improvement. We want to make sure that the tool is doing what we think it's going to do. And so if you're seeing something in it that you think it could do a better job at sharing, you know, how it shares that information, we want to get that feedback as well. And I think that's all we have on the reward plan and PER. So if there's any questions, does anyone have any questions that they'd ask?
Okay, thank you, Jana. So I want to move on to what you can expect in the coming months in terms of incentive payments. What's on the schedule? So coming up very soon will be clinical integration payments for the, I guess this is fourth quarter 21. So that means for all of your attributed Excelis and MVP members, all lines of business, commercial, Medicaid, Medicare, for all of those attributed members, we pay out to practices $1 per member per month. So 1 times 3 for each of those attributed members. That's what you'll be receiving the week of March 21st. All of you have been so accommodating through COVID and so kind as to share your banking information so that we are now enabled to make those payments directly to your accounts. And the day that happens or the day prior, you'll receive a communication from Jana or myself detailing what this payment is and including a payment detail report that shows you how the dollars break down per provider in your practice. So that'll be coming out March 21st, and the week of March 21st, and we will also include some information about the 2022 quality measures with that communication accompanying the payment. Quality incentives are due to be paid out in early April. Now, we just reviewed the new PCP reward plan that starts for this performance year, 2022. What we're going to be paying you in early April is going to be under our old incentive plan for performance year 2021. So this is going to be that gold, silver, bronze, and it's going to just be driven by your performance to our quality measures. An important thing to note is that for lead, with all of the challenges around lead screening, as Elizabeth mentioned in her review of the 22 measures, we've decided that for the 2021 quality incentive, so the incentive for this past performance year, that you'll earn points for lead based on your current performance or your prior year performance, 2020, whichever one is higher. Because we don't want to disincentivize you. We appreciate the challenges facing practices with the inability to perform point of care lead testing. And we want to make sure that we're being fair. So whichever is higher, your performance for lead for 2021 or 2020 is what will be included in the calculation. So those payments will be coming out early April. And just like the clinical integration, same thing, we deposit those directly to your accounts, and we'll send an email communication that'll include the provider breakdown, an explanation of the payment, and lots of information as well about our 2022 quality measures. And then finally, gain sharing. And I know that, gain sharing is never a guarantee, right? But happy to say that it is a guarantee, and that at least we're under some of our contracts, AHP is going to earn gain sharing, and there will be gain sharing based on 2021 performance that's paid out this year. Some of you are hopefully aware, I think we reviewed this a while ago, is that AHP does have its own insurance company. The AHP Insurance Company is a captive insurance company that we established in order to protect the network and to insure ourselves against risk. So what this puts us in a position for, and why this is relative to the gain sharing conversation, is that if we do have losses, we pay for those out of our insurance company so that the gain that can be shared with you without losses being netted out. So there will be gain sharing coming up this year. You'll be learning more about those, what that will be in the coming months. And that will be paid out as well on our prior gain sharing methodology, which, as you recall, had a base component, which was a flat amount that every provider who participates receives, a quality component that is based on your performance to your quality measures for 2021, and then an attribution component, an amount that's based on the number of active patients on your panel. So that will be coming out in August or September of this year, and lots more news coming along the intervening months about how we're calculating that. Any questions about our upcoming incentive payments? You guys are a quiet bunch today. Okay. So the next item on our agenda was open discussion, which I'm not really hopeful for since you guys are being really quiet today. But I'll start that with just a couple of FYIs that we wanted to make sure that we shared with you and didn't have another good place in the agenda for them. First of all, reminder, COVID calls have moved to bi-weekly. So there will be no COVID update call today. The next one will be next week, Wednesday, and there'll be every other Wednesday until such time as we no longer need them. If we have information that needs to be shared more urgently than the call cadence will allow, we will push those out via those COVID update emails. So no COVID call today. Please make sure everyone in your practice is aware. Zoom licensing, when the pandemic began, AHP purchased Zoom licenses for practices that needed to jump into the telehealth world immediately. We're happy to say that many of you are still using those, but many of you have found other options or just aren't using telehealth to the degree that you once were. We have reached out to many of you about your Zoom usage and have spoken to you and in some instances agreed that you no longer need those licenses and we'll be turning those off. So for those of you, and you all should know who you are because Jana did good work reaching out to you and asking for your thoughts on this. But for those of you whose licenses are being turned off, that's going to be on March 17th. So just want to give you an FYI on that. If there's anyone on this call that still has Zoom licenses or feels like they need more and you didn't hear from Jana, please reach out to Jana if you have any concerns. And then finally, one thing that I am going to, hopefully this will kick us off into a discussion, is talk about your meeting preferences moving forward. As I said when we began our meeting today, the provider relations team would like to get back into the business of visiting with your practices more frequently. We have a lot of big initiatives to roll out, and that's going to drive a lot of those visits. But we also want to just get into that cadence of checking in and putting our faces in front of you and continuing to build our relationships together. So we wanted to ask about if there is any consensus in the group. Our video visits more easily accommodated? Do we continue to conduct our work with you over Zoom? Are some of you opening your offices now to visits from vendors and you'd be willing to visit with us? Would love to kick off a discussion on your thoughts about those, what your preferences are for continuing to meet. And this meeting as well, your thoughts about if this meeting should return to in-person. Jerry is happy to meet in person from Westside Pediatrics.
Hey, Renee, it's Lynn Walsh from Thompson. I think that Zoom works wonderfully for us at this point. Just given the number of us, it's much easier to collect everyone through a Zoom.
Great. No, thank you, Lynn. That makes a lot of sense for our bigger systems where folks are coming in from a lot of different places. Yeah. That it would be more convenient. And that's a good point as well, is that, you know what, Jerry, if you're willing to have us visit with you in person, but Thompson wants us to keep doing Zoom, obviously we'll accommodate anyone's wishes and we can be flexible. Okay. Gotcha. Chris Curtin from Stony Brook Pediatrics mentioned that she likes to attend in person, but Zoom makes it more convenient for these types of meetings. I got to say, I agree, Chris. We used to do this meeting in person and then have a Southern Tier meeting in person. But I have to say, it's certainly more efficient for us all to meet together via Zoom for this practice managers meeting. Okay. I appreciate all these comments. Thank you. Well, certainly whenever we're scheduling a visit with you, we're going to make sure that we're upfront about the modality in which we will be visiting with you. So thank you. Any other comments, concerns, questions that we can answer for you? Any pain points in your practices that you'd like to put out to the audience? Maybe not even for help from AHP, but maybe elicit a best practice from one of your other practice colleagues. Okay. Thanks. Still getting chats in the about the Zoom versus in person. I appreciate this, and we will capture your individual preferences as well from the chat. So thank you.
Renee, I just had a comment, if possible.
Sure, go ahead, Sue.
I was just curious, when Jana was talking about the provider engagement report, she mentioned that there were some practices that were in a pilot program. I'm just wondering, what is the time frame for reaching out to the other practices for implementation? Do you have one or?
Sure. Well, one big critical path is the need to get some particular data available to us in the report in order to roll out to pediatrics. So pediatrics, we won't be reaching out to until at least April. We need to get a couple of more adult practice pilots rolling, but I would certainly say by May, everyone should have heard from us. With at least these are your reward plan domains, and start getting sort of eliciting some feedback on appropriate times for demos and intro meetings and getting the ball rolling. But thank you, Sue. I appreciate your question.
Yeah, and then I was just going to ask, is it possible like the care managers in those practices be part of that, so we know when that's going to start too?
Sure, we're definitely
Thanks.
trying to make sure that Danielle, Robin, and Elisa are kept in the loop about these scheduling and communicating through the care management enterprise for that purpose. Absolutely.
Great, thank you.
You bet. There was a question in the chat about guidance on mask mandates. I know they are still in medical facilities, but don't know if you sent updates on those. So where it stands today on the mask mandate is that the New York State mask mandate, as it relates to healthcare, there's only a mandate for state regulated healthcare facilities. So, according to the letter of the law, you in a private practice, not a state regulated healthcare setting, would be able legally to drop a mask mandate. LJ, Dr. Shipley and I are our medical director for maternal child health, and I discussed this quite a bit. And the advice that she is putting out there, and that we intend to talk more in our next COVID meeting, is that while in private practice a mask mandate may no longer apply to you, that you still have an obligation towards infection prevention and mitigation for your patients and your employees, many of whom may be at risk for serious complications from COVID, and that the best course of action would be to continue requiring masking in your private practices until such time as the mandate drops for the state regulated setting. That would be really the safest way to go to meet your obligations for infection prevention and protect your patients and your employees. So that's the advice that our medical director wanted to share with you, and we'll be sharing with you more formally. But the letter of the law, as it says today, is in a private practice setting, there is no mask mandate any longer. So we appreciate that the mask mandate was a good thing to stand on for patients who were, griping. But we hope that your obligation for infection prevention provides just as strong a foundation for you to stand on in those conversations with patients. PTSR, was that what you were looking for information? Okay. Oh, someone said, even if you take state funded insurance in a private office, that is not a state regulated setting though. The communication that I saw from the state says state regulated healthcare facilities. So by virtue of taking Medicaid, that does not make the mask mandate apply to you as I read it. But as I said, we are very much in favor of you continuing to mask. For example, at AHP, the university recently put out that if you were in a remote location like Corporate Woods, where AHP's offices are located, you don't need to mask anymore. We made the decision at AHP, we're going to continue to mask. We have staff who occasionally come into the office that have little kids at home that can't be vaccinated. We want to help protect those staff members and their kids and each other. So we're continuing to mask, even though we don't have to, according to the state mandate and according to our employer. So we want to encourage continued masking. There was another question from Jerry at Westside asking about increases in costs not being that the insurance reimbursement is not keeping up with those increases. And can we get a panel of internal medicine or pediatrics to negotiate some contracts? So, as I stated, Fidelis at present is our only fee for service contract, and most of our contract, all of the remaining contracts are value based. I'm going to ask Mark if you're willing, and since you're on the call, I would like to ask you about AHP's role. Have you responded to this question about our role in fee for service contracting?
Sure, and thanks, Renee, because when I saw Jerry's question, I was actually going to chime in with a question of my own, so I'll get to that in a moment. So, as Renee points out, traditionally, with the exception of the Fidelis contract that we reviewed earlier today, our role has been value-based contracting, and we have not been engaged in fee-for-service contracting and have not negotiated on behalf of any of our physicians, whether they're our friends in private practice or they're the medical center employed physicians. And there's a number of reasons for that. And one of them, without getting into arcane legal reasons, is having to do with, do we have the appropriate clinical and financial integration where from an antitrust perspective we would be allowed to, as opposed to appear to be collective bargaining without the appropriate sanction for that. So we won't turn this into a legal lecture this morning, but that's a serious issue that folks like me would be awake at 3 o'clock in the morning worrying about being on the wrong side of. But that's not to say that's where we'll be forever. I mean, I think the vision of value-based contracting was that over time, perhaps the year-over-year fee-for-service increases would be less because the opportunity to gain money via gain sharing would be more. But if that doesn't happen in reality, if the rates are flat and they're not keeping up with inflation, then that's problematic. So as we look at AHP's future, I don't rule out that at some point in time that we might decide to get more deeply involved in fee-for-service contracting. Of course, that would require that the physicians would want us to do that for them and sanction us to do that. It also required that the payers would want that. So I think just from a leverage perspective, I think the payers would, if they wanted AHP to get involved, AHP would have to give up something to do that. So there's a lot at play there, but I think the bottom line is, while we're not doing it today, I do not rule it out for the future. I'm interested in, Jerry, whether you as the one who posed the question or anyone else's knowledge of it. Since we're not involved in fee-for-service contracting, we don't get information from the payers about it. And I'm just curious from folks what kind of fee increases that they've seen from MVP and Excellis for 2022, if anyone wants to share that.
I wish the
Doesn't sound
chat had those little dots from the text messages so you could see who's typing.
Right,
sure
yeah,
someone
that'd be
is.
helpful. But if anyone has information they want to share offline, that would be helpful. Very, very minimal. Okay.
Mark, I think you bring up a good point that would be helpful if practices would be willing. We appreciate this is touchy and the payers make it touchy, but in any way that you're able to share information about the details that, Jerry, some lines went up, some lines went down, whatever you're comfortable sharing puts us in a better position to assist you. And there certainly have been some fee-for-service issues that have come up with reimbursement being drastically cut or claims denials coming through, where we have engaged our partners at Excellis to talk to them about the problem and have had some success resolving those issues. So while we're not into full-blown fee-for-service contracting, wherever possible where we can assist you, we will, and that getting us, keeping us in the loop on the trends in your rates is certainly helpful to that endeavor.
Definitely.
All right, guys. Well, if there are no other items for open discussion, I'll start getting us wrapped up. First of all, last call. If you haven't already, put your name and your practice in the chat. And another reminder: there's no COVID call today. For my final reminder that I give at every meeting, because I just can't help myself. Remember, you are an AHP participating provider. It's important that every member of your practice who might be in the position to answer a phone call or have an interaction with a patient that might include the question, "Are you an AHP?" should be able to know, yes, we are an AHP participating provider. Certainly for those practices that are on this call that are eager to get new patients, this is an important thing for your staff to know. But it's important for every practice to know and to refer their patients to AHP specialists, hospitals, and imaging and labs so we can take advantage of our better communications, our more integrated care delivery system, and that benefits patients. If we're sending our patients out of network, we're not achieving for them the benefits of clinically integrated care. So just my annual reminder. These are all of our AHP contacts that you may have occasion to reach out to. And like, as I mentioned, don't scribble these furiously. We'll be sending these out via email right after this call. Cherie Turpin will be your contact for any updates, such as we have a new address, or such and such provider is leaving, or this provider is joining our practice. So Cherie Turpin is the place to go. Jana is going to be your main contact for many, for Vatica, certainly, and then for anything else related to provider relations, as am I. Elizabeth Sharp, your contact for optimization, Willie Newdigant for Arcadia, and then we've got on here our behavioral health integration team, which is able to accept your emails and get back to you with any questions for behavioral health consults and care for patients. And same for the pharmacy team, which can accept your emails and respond to your questions about pharmacy. I just saw a question. Do you have a list of AHP providers on your website? Of course we do. If you go to ahpnetwork.com, up on the top right, you'll see provider search as a big yellow button, red button. And that's where you can search for providers. So absolutely. And that's a good place to go and check your own information and make sure it's current. We'll also be sending out information about these other contacts, RMS Healthcare for the PCMH and other healthcare consulting, Medline for medical supplies, and Atlantic Health Partners, the group vaccine purchasing organization. And then finally, our next practice managers meeting is going to be Wednesday, June 8th. We're going to have more updates about our rollout of the provider engagement report. We'll certainly have more up-to-date information about 2021 gain sharing, and I'm sure lots of other information for you. So we hope you'll join us Wednesday, June 8th, and based certainly on this feedback, we will absolutely plan to have that meeting via Zoom. Thank you for your time today. We really appreciate it. We know how busy you all are. Hope everyone has a great day, and please keep in touch. We look forward to seeing you again soon. Bye, everyone.
Thanks, Renee.